So today we're really excited to have Dr. Brad Reedy. He is the owner and executive director of Evoke Therapy Programs. He has a really amazing experimentally based therapy program for adolescents, young adults, and families. He's also the founder of Enlightened Relationships and provides coaching, couples therapy, and individual therapy. He's written a number of books and has a great podcast that has over 400 episodes already. And I'll put those in at the end so you can see them, so you can check them out. And then we also, of course, have Nanette. Nanette is the president and CEO of Hired Power. She's currently recognized as one of the top interventionists in the country, an industry expert, both nationally and internationally. And she, began the journey to develop, build, and grow Hired Power, which is a resource available to help bridge the gap and bring recovery home. So I will share a little bit more about the Hired Power services at the end. But for now, I think that we should get started.
Well, thank you, Risa. It's a pleasure being here. Thank you, Dr. Reedy, for joining us today. We're very excited about having you as our first guest on the podcast webinar. And happy to have you here talking about the dance of addiction with families. Families are in such a crisis right now. I think we're seeing more and more through the pandemic, the isolation, we're seeing a lot of increase in mental health and addiction and in family dynamic struggles. So excited to hear what you have to say. Please be patient with me as I'm going to field some of the questions and answers. So if I interrupt you, I don't need to be disrespectful. I'm just trying to get some of the questions answered from our viewers and listeners. And as I said, we're happy to have you here today.
Perfect. It's an honor to be here. I think I want to start off with a story to begin to kind of set the stage. I hope, first of all, that you're going to hear some things if you have some experience in this area, that you're going to hear some things that feel new to you. And if you're brand new to this experience, I want to start off with a very basic foundation. So I'll tell a story about myself as a father. I have 4 children. My oldest, who is now 28, when he was a teenager, he dabbled in substance use. And this story is about him and about my experience with him as a father. At one point, this is actually after we had sent him to treatment. He was home. It was a middle school. Middle school here, this particular middle school goes until 9th grade. And I got a phone call one day, much like today, from the assistant principal telling me that there was a problem, that my son might be sick. And he asked me, can we take him to the hospital if we need to? And I said, of course, you can take him to the hospital. But I lived just a couple of minutes away, and I said, I'll be there in 5 minutes, dropped what I was doing and headed over to the middle school. In that 5 minutes that it took me to get there, the assistant principal had found out some information. Part of what he had found out was that my son had been drinking in class. He'd actually taken a Mountain Dew bottle and filled it with, I think, rum or something like that. He was drinking rum and Mountain Dew in his class. And he had gotten to the point that he became severely drunk and inebriated. By the time I got to the school, he was in the bathroom and he was vomiting in the toilet. When I got there, he said, "I'm sorry, Dad. I'm so glad you're my dad. I'm so glad we can work this out together." And the vice principal was saying, either you or we recommend that you take him to the hospital, make sure that there's not alcohol poisoning. So I gathered my son and we drove to the nearest hospital to have him checked out. Apparently, when you bring a teenager to a hospital for potential alcohol poisoning, they send out a social worker to talk to you. So my wife and I, both therapists, both having decades at that point of experience in this field, were met by this social worker. And she started off with, as she sat us down, saying, you really need to be on top of things with your son. You really need to talk about and pay attention. And I wasn't in a good mood and I wasn't very nice. And I said, okay, here's what I am doing so far, just to give you a glimpse. I've sent my son to treatment, 2, in fact. I have drug testing. I have a breathalyzer that I got from the Utah Highway Patrol that they use. I have testing, the best in the country. In fact, we've used hair tests to complement our urine tests just to make sure that we're getting everything. I've created a community group of parents where we come and we talk and we bring in experts with all of my son my son's friends and our neighbors so that everybody's on the same page, so that everybody's learning. I've attended Al-Anon, I've attended Codependence Anonymous, and I listed all these things. And by the way, my name is actually Dr. Brad Reedy, not just Brad. I have a PhD in this field. And I wasn't very nice about it at all. I was being sarcastic and flippant. And after saying all of this, she of course took a step back and said, oh my gosh, you need to relax and you need to maybe let go of control and you know, take your foot off the gas and just pull back a little bit. This led to more sarcasm on my point. Of course, I'm feeling very vulnerable. My son, my firstborn of my 4 children, is suffering from what could be a debilitating addiction. And so I said, so which is it? Tell me which it is. Because when you started, you were telling me I wasn't doing enough. Now you're telling me I'm doing too much. So why don't you just tell me exactly what I need to do? And I'll do it. In fact, not only will I do it, but I'll tell everybody I know. Since I have a fairly decent audience, I'll tell everybody I know exactly what I should do, according to you, to prevent this problem from occurring, so everybody's clear on how to manage this.
Don't we wish it was that easy, Dr. Reedy, to just have a roadmap, right?
Right. So it wasn't very nice of me. It was very unkind. And she said, I'll be back in a minute. And I never saw her again for the rest of the hospital visit, which I think was probably a wise move on her part, because I was pretty upregulated and hurting and vulnerable as a parent. But as I've reflected upon that day since then, this is about 14 years ago, I realized that she was right in one way. And the way that she was right, that the thing that she spoke to, the truth that she spoke to is that part of me that thought that I could control it, that thought that I could prevent it, and that thought that it was up to me. You know, I'd spent so much time in my life as a therapist already dealing with mental health and addiction issues with clients and families that I kind of had this mindset that I have all the tools that anyone should need to have. I have recovery, I have therapy, I have all that I should need to have to be able to manage and prevent this kind of crisis. And I'm going to be sophisticated about it, but I'm going to employ them and I'm going to be able to control the situation. And the first thing I want to talk about today, and it leads us into the nuance of the family dance of addiction, is that you can't control it. And I do think at times we in the mental health field, in the addiction field, I think we do a disservice by implying that you can control it. When we talk about the family dance or the family dynamics or codependency, which I'll talk about at length today, there is an implication that if you do it right, your child won't struggle with these issues. Or if you're married,
neither will you. Yeah.
Say again?
And neither will you.
Right. Right.
You know, if you do it right, you won't struggle, you won't feel the pain or the suffering, and neither will your loved ones.
Yeah, you can prevent it. And that's what makes this discussion today so difficult, is we're going to talk about a dance. And what's nice about the metaphor of a dance is that it's something that you do together, that not necessarily as one person leading, but in the metaphor of dance, we're suggesting that 2 people are doing it together and that they're kind of at times leading each other and participating in this thing that they create together. So today we're going to talk about the family dance of addiction and the co-participation in the process. As I start with that, I'll also say one other thing that might sound at odds with the premise of talking about family addiction. And that is that I have seen people with something we call codependency. I'll talk about that in a minute, but this kind of co-participation, this dance. I have seen people with more codependency traits who don't have addicts in their lives, addicts in their family. And I've seen people with less codependency who have addicts and alcoholics in their lives. So codependency, the disease, the issue, the characteristics that are inherent in a codependent are present separate of the addict or the alcoholic in your family. Mm-hmm. What they do, of course, is they tend to blend together to encourage each other, like a dance. They tend to feed off of each other. So the goal is to figure out a way to focus on your codependency, on your participation, on your dance, without taking responsibility for the addict or the alcoholic, for understanding. We use words like your contribution, your encouragement. I get asked the question all the time by parents that says, if it's not our fault, why are you always teaching about family work?
Right.
And my answer to the question is because we are at times inadvertently and unconsciously encouraging and reinforcing behaviors that we are complaining about.
And participating. They're often participating unknowingly or sometimes knowingly in a way. I like to use the word in codependency of over-loving, over-caring, overdoing.
Right.
And that's how we're participating. We're overdoing, we're over-loving and unable to set healthy boundaries.
Those are great words to kind of metaphorically talk about what it feels like to be in it, right? Because you can't love your addict more than Nanette does. I mean, we can't love your addict more than you do. I'm sorry. The treatment professionals, the therapists that you meet, they're not going to love your son, your daughter, your spouse, your brother, your sister, your mother, your father. They're not going to love them more than you do. But that distance and that clarity that they can add to the family can help you get clear, can help you to separate, can help you to pull apart. We talk about addiction being a disease, and rightly so, and we can talk about that, or I can address that if that idea doesn't sound right to you. But my question is, why do we talk about it as a disease? And one of the reasons why it's talked about as a disease is because the alcoholic or the person suffering from substance abuse disorder doesn't experience it as a conscious choice. They experience it as a compulsion. They experience it beyond their ability to kind of consciously will themselves out of it. They lie to themselves. Their brain has a voice inside that confuses them, that mixes them up. They think that they can have one drink. The disease model teaches us that slippery slope is absolutely the slope that leads to addiction problems and addiction issues. But the same is true also with the codependent, with the family member, with the loved one. I told Nanette this story earlier. I once had a father that I was working with, and his son, who was on the verge of young adulthood. He was still under 18. He had violated several thresholds in the behavioral contract that they'd come up with together, that the young man had signed, several things that he wouldn't do. And the father called me for a session and said, Brad, I know you've taught me not to yell. I know you've taught me not to guilt and shame. I know you've taught me not to lecture, but last week after this last incident, I marched up the stairs to his room and I said to my son, I yelled, I shamed, I blamed, I lectured, and I said to him, why are you doing things? Why are you doing things that in the contract are clear that you know you're not supposed to do? And I said to him, so let me get this straight. You went up and against your own better judgment and asked your son why he was doing things that ideally were against his better judgment. And there was, of course, a quiet and knowing pause. And I said, so what you can do, go back upstairs after we're done with this phone call, and you can say to your son, I know why you did it. I understand because I do the same thing. The idea of the family dance of addiction is to focus on what you can control and to focus on your issues, your patterns, the things that you're compulsively, everybody listening to me, watching today, can relate to doing things compulsively when we are triggered, when we are afraid, when we're feeling shame or rage or anger. We can identify doing things out of habit, out of that feeling of compulsion to try to control things. That's how the addict feels. So the idea of calling the disease of addiction a disease can help us if we understand that our co-participation, our participation in that dance is its own disease. That we have a way of participating. This is important language. We have a way of participating with those that we love that are struggling with addiction. We have a way of participating that tends to reinforce the problem, that tends to reward the problem.
Brad, can you give some examples of that? I mean, I think that's such a key message right there, so important for our listeners to understand. So give us some examples of what that may include.
Probably the simplest example is around boundaries, right? That we will compromise our own boundaries. We'll have boundaries around, I don't want drinking in the house, and then there's drinking in the house. And so we allow for it, or we even make up for it. In extreme examples, we clean up the mess. You know, we hire lawyers for our loved ones. We pay extra money to get them out of trouble. We start to, I mean, the term is enabling, but we start to inadvertently, it's very unconscious, but we start to inadvertently support the addiction by removing consequences, by not holding lines. And what's, I think, terrifying and tragic about it is we're just trying to keep them alive. And so sometimes those enabling behaviors, they get you through the day, but over the long run, they don't contribute to a shift in the dynamic, to a shift in the disease. To allow somebody to suffer a natural or logical consequence from their addiction is to let them to live their own life, to turn it over to them. There's a saying in AA and in Al-Anon that says, the difference between me and God is that God never thinks that he's me, right? We codependents, we people who love addicts, or even if we don't have an addict, but we people who suffer from this disease of codependency, we tend to think that we're in control of things. So that woman in the hospital that was trying to help me, whether she knew it or not, she was speaking to that part of Brad Reedy who thought that he could engineer and control and mastermind this whole plan so that his son wouldn't struggle with the same things that children that I've treated have struggled with. So I think yes, it's based on denial. But here's another thing that I think is important, Nanette. Abraham Tversky, who wrote a book called Addictive Thinking, a great book. You wonder what the disease of alcoholism and addiction is, aside from the actual use of the substance. Abraham Tversky's book, Addictive Thinking, is a great resource. And one of the things that he says when he meets family members is they say to him, they ask him for advice and they say, tell me how to help my child. Tell me how to help my spouse, my brother, my sister, my parent. But he says it's kind of like they're asking him, tell me what 2 + 2 is, but don't say 4. Right? They have all the same reasons for not seeking treatment for their co-participation in the dance that the addict has, which is, it's not my problem,
Right.
or I don't have a problem, right?
Right.
Or I can do this on my own. I don't need to go to some group and tell people about my life to do it. I'm managing my life just fine, right? You could substitute those same phrases and words for an addict or an alcoholic or for somebody that's participating in the dance, and it would be the exact same language. It's the reason that you, mom, dad, brother, sister, the reasons that you're resistant to getting help and looking at this are the exact same reasons that your loved one struggling with substance abuse disorder or addiction is resisting it. So if you know that can give you some insight to say, I wonder what work there is for me. I wonder how I can extricate myself from the dance. I wonder how I can get out of this kind of mutually reinforcing pattern with my child. Which substance abuse, let me be clear, substance abuse isn't caused by codependency. Neither is it cured by codependency.
Right.
That's really important. The only thing that happens when somebody is in recovery for codependency, when somebody's healing in their codependency, the only thing that happens is that they get better. Now, what we know is, and we have to be very careful about this, when a mother gets healthier or a father or a spouse gets healthier, there's a tendency that the people in their lives have to start relating and participating in healthier ways with this person, right? Because that now is required. If I get healthier and we're in a relationship, then I'm going to require certain kinds of healthy and appropriate behaviors. And I'm going to require you to treat me in certain ways because of my health, because I'm getting better at it. So it does tend to have that impact, but it's a really subtle nuance between cause and effect and dance. And if you fall into the cause and effect trap, even if your intentions are quote unquote good, if you fall into the cause and effect trap, you're part of the problem. Then their recovery is your responsibility, Their addiction is your fault. And we have to find a way to kind of live in the both, live in the gray area, live in between, live in the nuance that I can participate in a dynamic and not be ultimately the cause of it. I can participate in a dynamic and withdraw my participation and not be feeding the monster anymore. I mean, that's part of it. Part of the enabling, the rescuing, the taking care of consequences, not holding up your boundaries, all of those things, that's feeding the animal that you want to see go away. That's feeding the monster. So your job is to pull yourself out of that dance, to stop dancing with the addiction, to stop dancing with the addict. And part of that means taking responsibility for your own life, taking responsibility for your own differentiation. I talk very specifically with everybody that I talk to. This includes my employees. I'm the executive clinical director at Evoke, and I have 2 clinical directors that work under me, 3 actually. My discussion with them is talk about your disease. Talk about your disease of codependency, your disease of co-participation, your lack of healing, your attachment trauma, your lack of awareness. And when you do that, you're doing, that's modeling for the addict the work that it takes. Instead of sitting on the sidelines, which is very tempting to do because the addict is a mess. The addict has lost jobs, their health is at risk, right? They've been arrested, they've dropped out of school, they've lost friends, they've lied, they've cheated, they've stolen. They are obviously a mess. By the way, there's a term for that. It's called a scapegoat. When the village puts all their sins on the goat and sends the goat out as a sacrifice, addicts become the scapegoat for the family disease, right? The addiction is a manifestation of a family dynamic that needs attention, that you're participating in. And while yours doesn't look as chaotic and compromised, it's still at the dance of the family. So your job is to do your work, to stay on your side of the street and to stop feeding that monster.
So, Dr. Reedy, we have a great question, and I think it goes along. I was going to ask, oftentimes we change our behaviors or change the dance, obviously with the goal of our loved one changing. And when we don't see that as a result, where do we find the hope to stay in that dance, to hold those boundaries, to stay with changed behavior, even though our loved one may not be making healthier choices or may not get in line with us? How do we stay in that hope?
I'll start off with something. I want to get to the worst case scenario that you just asked about, like the very worst case. But I'll start off with the less than worst case. One of the things we learn if we attend Al-Anon, this is something else that I think about all the time. It's very important when you're seeking out treatment professionals, when you have a loved one who's suffering from addiction, or if you yourself are suffering from addiction, that you find people that don't just know about addiction, but understand the dance that we're calling codependency today. Because those are different dynamics, right? The disease of addiction is its own knowledge field of study that is really valuable and important to understand. And if we understand it, we have compassion toward people suffering from it, right? Because we understand that it's a disease, that it's a compulsion, that it's outside of their kind of conscious will. But there's work for the loved ones to do. And one of those principal pieces of work, Nanette, it's one of the hardest things to teach, but it's the truth, is that you learn when you go to Al-Anon that your serenity is your responsibility.
Right.
And so the hope has to come from how you're living your life. I think one of the hardest things for any of us to break through, I think it's true for all of us nearly, is that our unhappiness is our responsibility to work on, to manage. There's a saying that I use broadly, not just with addiction, but with all mental health, all parenting, in fact, that says, that old adage of you're only happy as your least happy child? That's insane.
I say that.
It's something that's promoted in our culture.
Right.
And when we think about it, it's crazy. Because the burden then is that the child is supposed to be a certain way for us to feel okay. And that's a heavy, I would argue, crushing weight for them to bear. Gandhi said it this way. Gandhi said this is a quote from my second book that I put in my second book. It's not from my second book, but I put it in there because it's so profound and captures so much of this question of yours, which is Gandhi says that a coward, this is his quote, a coward is incapable of exhibiting love. It is the prerogative of the brave. Projection, fusion, and going home is easy. Loving another's otherness is heroic. And he goes on to say, if we love other as other, we have heroically taken on the responsibility of our own differentiation and our own journey. And this heroism may properly be called love. So when I get a family, when you get a family, we're going to treat the whole family. And one of the shifts that we're going to make is that your peace of mind and well-being is not dependent upon the addict. In fact, I think in part, and this is literally a 10-hour lecture. In part, I think what addicts are medicating is the shame that they feel for hurting the people that love them the most and how poorly they have done with that love. And so they're medicating and trying to anesthetize this shame. That's why so much of addiction work is around shame and inventories and letting go and forgiveness and so forth. They're medicating the idea that it's their job to make us happy. It's not their job to make us happy. And so we will accept the addict or the addiction. A lot of people would rather we say person suffering from addiction instead of addict. They don't like the label. We will accept the addiction and the person suffering from it as the pass for entry. But once people get into our systems, your system and my system, we start treating the whole family. It's kind of like the Trojan horse, right? The gift is the horse, but once we get through the gate, everybody gets out, all the professionals, all the family educators, all the parent support staff, the webinars, the podcasts, the books, right? The family therapists come out of that horse and start to treat the whole family. And we just find that that's a much more effective way is to intervene at every level in the system. So you don't have to do it. You can walk away from this and you can say the addict it's their problem. It's not my problem. I'm going to walk away. You have that right to do that. But what you miss out is in the joy of healing and the joy of participating in a healing process that will change your life. Because our model suggests that when families are struggling with addiction, that it's just highlighting everybody's trauma, everybody's attachment wounds, everybody's misunderstanding about what it means to be a person and to love another person. What Gandhi was saying in that quote is, going home is easy. Familiar is easy. But loving an other as other, loving an addict, even though they're different from you, even though you hold down a job and you show up on time and you don't get arrested for driving under the influence, even though you're managing that, to really love another person, you do a deep dive into your own work. And you might be 2% of the equation, but taking 100% responsibility for 2% of the problem is the most liberating and empowering thing that you can do for yourself. So my answer is, D.W. Winnicott, a famous therapist, said that it's the false self that brings the real self into therapy, meaning that what people come into therapy or treatment for isn't the real issue, that the real issue is much more profound and much deeper. And you don't know. Guys, I've been in therapy for 22 years with this therapist, let alone the therapist I had before this one. Okay, 22 years I've been with my current therapist that I still see on a weekly basis. And what I know is that therapy is much different than it was 20 years ago when I started. That I'm asking different questions. The project is different. And so we changed the project. And that's the answer to the question. We changed the project to, if you walk into an Al-Anon meeting, which you'll be asked to do, if you have a loved one struggling with addiction, they'll ask you to do that. You'll go there with the, if not conscious, the unconscious thought of, tell me what to do so I can help my addict. Right. And they'll say, that's your ticket for entry. You have a qualifier. That's what they call them. but you have work to do that is independent of your addict. In fact, the fact that you've tied together and fused your problem into their problem is the problem. The fact that you think, they talk about in Allen on the 3 C's, cause, cure, and control. The fact that you think you caused it, that you can control it, and that you can cure it, that is the problem, much like my opening story with my son. That's what she was speaking to. That's why I was so defensive and angry with her, is because she was speaking to that part of me that thought I could cause or not, control or not, cure or not. So you have to realize and take responsibility for your own life. One of the best things that a parent can do, one of the worst things that a parent can do, or a spouse can do, or a brother, sister, is to not live their own life. And so you have to start being responsible for your own life. And then
so this leads into a great question from Mark Funkhauser. Is there a way to view the dance as a positive thing and not just pejorative? In other words, how can you exit the unhealthy dance and join the healthy one? So how do you stop doing what you were just saying? And how do you move into a healthy relationship, a healthy balance with someone, whether they're in recovery or not? Because that's the catch, right? Our loved ones may or may not be in what we view as recovery. Right. But how do we have a healthy balance?
You know, the way out, it's a great question. The way out is out. You know, if you came to me and said, what do I do? I would say, go to a meeting, get a therapist. Here's a book. And you would say, well, what's that going to do with my addicted son or my addicted wife? I would say, that's not your business. Your child's addiction is none of your business. How it impacts your life. I mean, those sound extreme because I have 4 children and Nanette, you know this.
Yeah, I have 4 too.
You don't love anyone more than you love your kids. You know, right. It's just, you win. So and my spouse, I love dearly, right? Like you love the people that you love. You love your parents, you love your sibling, you love your friends. So it sounds kind of extreme, but yes, you're always dancing. Mm-hmm. So yes, the dance is a shift. I'm going to say some extreme things, but they're true. We weren't taught what it meant to be a person and to love another. We just weren't. It wasn't modeled for us perfectly. I was watching this is how universal it is. I was watching this, if you want to Google it, you can later. It's called Step Inside the Circle. It's about this woman who goes around to maximum security prisons and does work around shame. And she does this wonderful, beautiful exercise out in the yard with all of the inmates. And then there's a little video, if you just Google it, you'll find it, of her interviewing them and having a small group of maybe 15 members from the prison having a group. And one of the gentlemen says on there, one of the inmates says, I'm realizing today that I'm a traumatized person who was raised by traumatized people. Mm-hmm. And that sounds dramatic to us because you might not have experienced overt, acute trauma. You might not have been sexually or physically abused or abandoned or neglected in severe ways, but it's another way of saying you were raised by human people. And so you have human issues, you have fallibility. And so the invitation of the addiction is for you to live a different kind of life. And you might be the one who's suffering from the addiction, or it might be somebody that you care about. But the invitation from the dance of addiction is to find a new way to dance. And my work, when I'm working with a mother, father, brother, sister, spouse, even a child of a parent, it's really, really hard work. But my invitation is, how can you participate in a dance with them that's healthy and that's supportive? And by the way, I do my best to not suggest that if you do it right, you're going to fix them, right? That's the
right.
Even though I keep saying that, I could work with somebody for a year and they're still asking me the questions. Happens all the time. People will say to me, well, can I say this to my son? And I say, sure. And then they say, well, will it work? And I said, well, what are you trying to get work? Well, will he stop using it? And my response is, maybe not.
Right.
You do it because it's a better way of living. See, recovery from codependency, recovery from the dance of addiction is being a healthier mother, father, brother, sister, parent, friend, employee, employer. It's living a better life. So whoever asked that question, you're absolutely right on track. Yes. But see, the other thing about it is I don't have a lot of shame when I say that I'm flawed and I'm broken. That's a part of it, is we have this, my mother, I was speaking in Orange County, where I'm from, where Nanette is based. And my brother, the jerk that he is, invited my mother to come listen to a speech I was giving. And I'll tell you, giving a speech about parenting with your parents present is not an easy task. But if I talk fast enough, which, as you might be able to tell, I'm capable of doing, I could probably lose her enough. But she got enough of my talk that she came up to me afterwards at the reception. My younger brother, 2 years younger than me, and myself, we were standing there talking. And my mother came up to us and she said, "I'm beginning to feel guilty for the way I raised you boys." And I said to her, I said, "Mom, I think it would be really great if you understood the mistakes that you made." I said, "I think it would be great for you. And I think it'd be a gift to us. I know for my younger brother, who doesn't participate in therapy as much as I do, it would be a really great gift for you to own that." And I said, "And I can't stop you from feeling guilt and shame about your mistakes. That's your business. You can feel those if you want, but it doesn't do anything for me. In fact," I said, "your guilt and shame are probably going to prevent and get in the way of you being aware of the mistakes that you've had." So this is another point. Shame and guilt, in most cases, prevent the work. They don't cause it. They're not the cure. They're the problem. One person I saw on the chat, I'm glancing over there once in a while, said, "Repeat myself about how addicts are people with addictions are medicating shame." I mean, I think at the core of every substance abusing person I've ever seen, there are these features that are inherent in the family. I think the primary addiction is this lack of awareness about what it means to be a person and to be in relationship with another person. And the shame, the overwhelming guilt and shame that they feel, they want to quiet that voice in their head that takes them away from who they are and what it means to be a person. So yeah, the shame and the guilt that we were taught, I was taught, you were taught, that are associated with conscience and morality. In this way of thinking, you start to do things from a different place, not from a place of shame and guilt and fear. I teach this all the time with people. If you're doing it from fear, it's really hard to get it right. If you're doing it out of love, it's really hard to get it wrong. And so this is a different way of being in a relationship with ourselves and a different way of being with other people. And to do that work, we have to do battle with shame and guilt. And I know there's this talk about shame and guilt are different things, but for the sake of today's conversation, I'm putting them in the same category. That everybody I've ever met in my life can answer this question the same way. If they can think of something or some things that they've done that are wrong because of guilt. In other words, they do them because they feel guilty. So you have to learn what it means to, this is about therapy. This is about understanding our wounding. This is about understanding our attachment, our past, the generational trauma, the trauma that is the small t trauma, not the big T trauma, but the small t trauma, which means being made fun of, not being heard or listened to, being gaslit by friends and family, right? It's that kind of work that we heal. And that when we heal, we don't need the medicators. We're not compulsively drawn toward the medicators as powerfully. That becomes a part of developing a life of sobriety as a person suffering from the addiction, or a life of sobriety as somebody who loves them. But it's the same work. It's really the same work. It's just that one person uses control to medicate, control of another person, and the other person uses a chemical to medicate. Some people use sex, gambling, work, right? You can use substitute anything over here. So there's this thing that we codependents do, we family members do to manage our anxiety and our stress and our fear. And then the addict or the person suffering from addiction uses chemicals to make their brain and their bodies feel different.
So if you're a family member and you don't really buy into that whole disease model, that whole chemical imbalance, and there's a difference between mental health and addiction. We spoke about that earlier, that neither you or I believe there's a true difference between mental health and addiction as far as a brain chemistry and disease. But how can families participate if they don't really buy into the disease model or the generational trauma that you were just speaking about, which is so huge?
I mean, that's a really good question. I think listen to some people who know about it. Listen to, it's worth exploring. Listen to the podcast. Read the book on codependency. Start to see if your answer is I don't want to deal with it and I'm not going to participate and I'm leaving. There's nothing I can do to control you. I can't talk you into it. But I think what I would say to you is it's a better way of living. It's a less angry, less scary way to live your life. And if you're suffering because somebody that you love is self-sabotaging using substances or any other kind of addictive behaviors, if you're suffering, then go to a place where other people have found comfort that are suffering from that same dynamic and start to listen and hear their story. You end up in an Al-Anon meeting or a Codependence Anonymous meeting, or I really am loving lately Adult Children of Alcoholics, because it's really just understanding your child in a lot of ways. See if it starts to fit and listen to somebody that's not rigid, that doesn't try to control you. Listen to somebody that can, for me as a treatment professional, when I have that mom or that dad, Nanette, or that spouse that says what you said, I spend a lot of time talking about how that makes sense. I spend a lot of time understanding them because in a way that's its own kind of traumatic response to the trauma.
It's one of those other it's just one of those other reasons why not to participate, right? You mentioned quite a few earlier that are fear-based, or a reason why they could keep themselves from participating. I think that I don't believe in the system, or I don't agree with it, is just another way to keep them from having to participate.
Yeah, and people go to meetings for the rest of their lives for a reason. They go to meetings because I heard this years ago, and this is a very simple but popular idea. People stop using drugs for the same reason that they start using drugs, to feel better.
Right.
And I would say people stop participating in the family dance of alcohol for the same reason that they started participating, and that is to feel better. So I'm not going to wrestle you to the ground and force you to a 12-step meeting, but if you want to be our participant in the solution, and if that solution is you having a better life, knowing that somebody that you love is participating in a life-threatening disease, I got a couple of ideas for you. It reminds me, Nanette, I wanted to speak about this because that worst case scenario. I was doing a presentation like this a few years ago with a bunch of professionals. And one of the professionals said to me, they said, Brad, how can you tell me that I need to tell a parent that they need to kick their 21-year-old opiate addicted son out of the house when the possibility is that he might die? And I said, I'm really sorry if I suggested that, but I don't tell people to do that. It's too great of a burden for me to bear. What I would do with that, if we're talking about a mother, is I would help her heal her codependency, which is to say, get clear on who she is, her own trauma, her own role, her own unconscious encouragement of the disease, all of that. I would help her to cure and heal her codependency, and then she would make the decision that she would have to live with. I've lost some clients in my career. I've worked with families who have lost children over the 25 years of doing this. And a long time ago, I realized that it's too great of a burden for any therapist, any expert. I can talk about principles and ideas. I can talk about co-participation and codependency. I can talk about the dance, but you're the one that's going to have to sit and deal with the fact that if your child dies, you have to deal with that. And so I lovingly and supportively will help you heal your stuff, and then you will decide the boundary. I always say this with codependency. This is also a subtlety. Recovery in codependency doesn't mean stricter boundaries necessarily. If any of you haven't watched the TED Talk by Johan Hari, that's JohanHari, called Everything We Think We Know About Addiction Is Wrong. So you can just Google that, it's a TED Talk. He speaks at this a great deal. Part of my healing in codependency is I can sit with the people that are suffering in my life with mental illness and issues and with addiction issues. I can sit with them more patiently. So recovery from codependency doesn't mean stricter boundaries. It means better boundaries. Boundaries for a different reason. Boundaries. So see, the shift in the codependent recovery, codependents or people that are dancing in addiction, they set boundaries to fix the addict or the person struggling with addiction. People in recovery from codependency, they set better boundaries to maintain their own sobriety, to maintain their own mental health, to maintain their own serenity, to get clear of the toxic aspects of the dance. So if we're thinking, if I do it right, I will fix my alcoholic husband, to, you know, if my wife were an alcoholic, for example, and I finally decided that I wanted a divorce. Let's say I came to that conclusion through my work and my own personal decision-making process, prayer, whatever it is, however you make your decisions. What the conversation might sound like is this. I might come to my wife and say, you can keep drinking if you want, and I can't stop you. And, you know, I am afraid you're going to die from it, or something maybe severe, but less extreme than that. I'm afraid something's going to happen. So I've been spending the first 21 years of our marriage trying to get you to stop drinking, and I give up. But what I am going to do is set a boundary. And the boundary is right now is I can't have this in my home. And if you want to go to treatment, go. I'm not threatening. I'm not holding this over your head, but here is my boundary. So you see, the boundary isn't the solution. The thinking is the solution. Just like not drinking isn't the solution. It's part of it. It's part of the dynamic and the dynamics of addiction, but it's not in and of itself the solution. They have a saying in Alcoholics Anonymous, what do you do when a horse thief stops drinking? What do you have? And the answer is you still have a horse thief, right? It's a disease of the mind, all of this. This is a diseased model. And so what I mean is, that sounds very extreme. It's a thinking problem in the family. It's a misunderstanding about what it means to love and to be loved and to have relationships and so forth. And so what we're inviting people to do is we're inviting them into a new way of being with the people in their life. And so my conversation with my wife is, I am done trying to control your drinking. Here is my boundary. And so in that way, I have a simple example. I tell this in my first book. I had a couple of parents call me. Their young adult son was going to a group home setting after our wilderness program. And their son had written a very respectful letter to the parents asking for cigarettes. And so they called me saying, should we bring him cigarettes? We don't, you know, the father said, my mother died of lung cancer. I hate smoking. My son knows how I feel about cigarettes, and I don't know, should I bring them? And I said, well, I could imagine that you show up to pick up your son and to drive him to the next program with a pack of these special cigarettes that he's asking for that he can't find locally. And I could imagine you handing the cigarettes to your son and saying, you can't smoke in the car. I'd like you to wait. Please don't smoke around me. That's my boundary. But here they are. And this is a sign that I'm not in control of whether you smoke or not. You know that grandma died, or grandpa died, and you know how I feel about it, but it's your life. Or I can imagine you showing up at the conclusion of our program, picking up your son to drive him to the next program, the group home, and saying, you know that grandma died. You know how I feel about smoking. It's your life, but I'm not going to pick them up for you. I'm not going to participate. Right. See, the boundary isn't the key. And the boundary goes back to that mentality that if I get it right, like the woman was saying to me at the hospital with my son, if I get it right, if I get this formula, this secret combination correctly, this silver bullet, I can cure somebody else. The only person you can cure is you, and that's going to take the rest of your life anyway. So
I think that's a good place, Brad. We've got 8 minutes and several questions, so I don't want to interrupt you, but I think that's a good stopping point, that statement itself.
Great.
Is great. Can I ask a couple of questions from our viewers?
Do.
Okay, one from an anonymous viewer is, we have 2 teenage boys who experience anxiety, depression, and have ADHD. How does a parent know or evaluate whether substance use is in fact substance addiction? Does it even matter, and why?
Man, I wish I included that question at the outset. I remember, in fact, Nanette, you were there. I tell the story all the time, but you were there. We were in San Antonio and there was a panel. I don't know if you were on it or moderating it, but somebody asked a group of addiction professionals how they, if a young adult was coming into their treatment for an assessment and was in denial of their addiction, you know, and the parents said, what are you going to do to my child to convince him or her that they're an addict? And through the discussion, the answer that I came up with is, that's not my job. I don't decide if you're an addict or not. I decide if I can tolerate what's going on in my home, in my relationship. And so it's, in a way, it's kind of frustrating to get this answer, but in a way, it's also very liberating. It doesn't matter. Your job is to decide what you feel comfortable with. See, I literally I do speak on this all the time on my podcast and in my books, but we could spend the rest of the day talking about this idea that you get to decide what you're okay with and what your boundary is and what you're going to do. And you don't have to prove to me or to God or to Dr. So-and-so. You don't have to prove to anybody that you're right. You just get to do what you get to do. You get to decide, I'm not comfortable with the substance use in my home. Like in the example with my marriage, I'm not comfortable with this. I have given up being the doctor for your treatment program. I'm going to be Brad, and I don't want this anymore. That is what the goal of healthy recovery from the dance sounds like. I'm not okay with this. And if the child says to me or the daughter says to me, I'm not an addict, my point is, good, let's keep it that way. And I'm going to give you some tools and exposure. So if it does become a problem, you'll know how to treat it. But my job isn't to convince you you're an addict. My job is, I'm not okay with you vomiting on my carpet. I'm not okay with you borrowing my car that I'm legally responsible for while you're using. You get to decide those things. It doesn't even matter if they're an addict or not. There are people, I've treated people that over the course of now 20 years, they haven't developed what people would say is an addiction, but at 16, they looked and sounded like it. Conversely, I've treated people that definitely looked like an addict at 16, 17, 18, or 19. And 20 years later, they tell me, you know what? I grew up and I have a couple of glasses of wine and it's not a problem. It's not my job. My job is, here's the boundary, here's the consequences. You get to decide your life.
And to help them manage the unmanageable behaviors, right? It's
Right.
about those unmanageable behaviors and attitudes and how do they address that. So we have another question. I just want to make sure we've got about 5 minutes. I'm raising 4 children whose bio parents are both meth addicts. My oldest, 14 and 11, spent their formative years in chaos and experienced complex trauma. My biggest fear is that they will become addicts. We talked about this, right, Brad? They've both been in and will continue with therapy, but their attachment wounds are deep. Is there anything you'd suggest we do to help prevent future addiction?
It's gonna feel trite, but get into recovery. The fact that you signed up to adopt children that have the potential of the generational trauma and the generational genetic loading that you've described probably makes a good case that you probably have some codependent traits, right? That I know it would for me if I were in that position. So start doing your work. And you know, what I teach people in this dance is, at the end of this hour, which is coming up in 3 minutes, my hope is that you'll just hear something, that you'll listen to the podcast or the books or find a resource or call Nanette and ask some more questions, that you'll hear something that you'll get into your work. My answer is, do your work. I said earlier, I've been in therapy with my current therapist for 22 years. I'm not in a crisis. This happens not because it's like saying only people that are overweight should go to the gym, right? You do this because it's like going to a nutritionist or going to a physical trainer. You do it because it's a better way of living. So my answer is, you have some cards stacked against you in the game. Start doing your work. Go to ACA, go to Adult Children of Alcoholics, and you'll say, well, my parents weren't alcoholics. And the idea is that all parents are human. It should say Adult Children of Humans. I wish that's what it was called. It just helps you to unravel. There's a great quote, the very first paragraph of my favorite book on children from Alice Miller called The Drama of the Gifted Child. I think it's the most important book written about children it's ever been written. In 1979, she wrote it. She said, our experience has taught us that we have only one enduring weapon in our fight against mental illness, and that is the discovery of the unique history of our childhood. We have to do our work. And so the fact that you have all this loading, do your work, because your fear and your anxiety is probably going to feed to some responses that are less than ideal, right? That you have some trauma that you're carrying and your responses are going to be less than enlightened. So go take care of that. One last thing, and I know you have another question. You take care of your fear and your trauma over here so that when you show up over here to the child, to the spouse, to the loved one, you're not operating from a trauma place. So my fear and anxiety I talk about in my meetings and in therapy. So when I show up to you, my son who's struggling with addiction or self-harm or bipolar, I can be there for you because I've taken care of myself over here. But if I don't do that, when I show up here, our interaction is going to serve to take care of me at your expense.
I think that's such a profound statement right there, and so important for everyone that's listening. So ending with the question, what is the number one book you would recommend for codependent family members of addiction?
Well, besides my two books.
That was kind of a lead-in, right?
I mean, I wrote a book called The Journey of the Heroic Parent, which is basically talking about your kind of parallel work and process. And then the follow-up book is called The Audacity to Be You. I mean, that's how I've interpreted all the books that I've read. Other books, Parenting from the Inside Out by Daniel Siegel and Mary Hartzell. Drama of the Gifted Child by Alice Miller. And then probably the Bible of codependency is called Codependence No More from Melanie Beattie. Those are probably the ones that stand out to me. Another great one on boundaries is The Dance of Anger by Harriet Lerner. It's a weird title. A lot of these don't have titles that make sense, but The Dance of Anger by Harriet Lerner is another great one. Those are the books that I recommend most often.
And I just shared your two books here up on the screen so everyone can see it and take a screenshot if that's helpful.
Both have audio versions. I read the second one. The first one's read by something else, and you can buy Kindle, right? You can buy electronic versions or paperbacks from Amazon.
Well, Dr. Reedy.
Sorry.
Go ahead, Risa.
In case someone's interested in a podcast and not a book, Dr. Reedy also has this great podcast that you can find on any podcast platform, basically. This is the icon you can look for. There's over 400 episodes.
Yep.
Well, I know, Dr. Reedy, you and I could continue on this topic all day, and we've touched on a lot of things. I think the most important thing you touched on was your own self-care. As a family member, being in a dance with mental health or addiction is starting with yourself and learning about yourself and learning how to be in a healthier, as someone else said, getting out of the unhealthy dance and getting into a healthy dance with healthy boundaries and healthy responses. So thank you so much for your time and your expertise today. It's always a pleasure listening to you. Is there anything you'd like to end with?
No, I think you said it. Thank you for having me.
We definitely appreciate you. And Risa, thank you for putting together our webinar. And we look forward to more Knowledge is Power webinars as we continue with our series.
Thank you so much to both of our speakers, Nanette and Dr. Reedy. I hope you've all enjoyed this. I know we didn't get to answer all the questions, but please, the phone number here that you see up on your site right now, you can call us anytime. We'll be happy to speak with you, day, night, weekends, whenever you need. So wishing you all a great rest of your day. And thank you again for tuning in.
Thank you.